So today we are touching on health, and the topic is the health aspect in getting ready for marriage. So I'm with the CEO of Dr. Ewua Sankofa Natural Health Clinic. So without wasting much time, let me introduce our doctor or our guest, Dr. Joshua. Please welcome to Jake's TV.
Thank you.
Please, how is the hospital going?
By God's grace, it's under control.
Okay.
The real name is Dr. Ewa Frank, but
Okay.
I'm also known Joshua.
Joshua.
That's my baptism name.
Oh, okay. So you're a Christian?
Sure.
Okay. So today we want to talk about the health aspects of getting married. So I want to ask, what is sickle cell? So what are some of the health conditions needed to be known before getting into marriage?
Thank you. Thanks for the question.
Okay.
You know, traditionally,
Okay.
it cuts across. Normally, they request for you to know your syphilis status,
Okay, syphilis.
hepatitis B status,
Okay.
sickling status,
Sickling, okay.
and blood group.
Okay.
They overlook certain things that really being, a main cause of these issues in marriage.
Okay.
Some may pass all these conditions,
Okay.
but a person might have been facing some infertility conditions that needed to be known and even start working on before marriage, but they don't do. Before they get married, they realize that some are sexually weak, they can't perform. If you can't perform, how do you put in the baby there?
Yes.
Some are having issues like PID, pelvic inflammatory disease, that it has to do with the woman.
Okay.
Some are having serious infections that later can lead to tube blockage and other stuff.
Okay.
Yeah. So being the four types that they normally request, I think we should revisit it so that we will go into even knowing the semen count, the men. Some are severely damaged.
Okay.
Some might even be aware of their status that they have low sperm count, but they won't say because it's not part of what we
So
examine
you want
for.
to tell me that these four tests that you mentioned is very common?
It's common. It's a traditional thing that all the churches, wherever you go, they ask you to go for premarital
But
test.
there are some tests that we need to know.
Yes.
Okay. That's what we are going to talk about.
We will talk about everything.
Okay.
Yeah.
Okay.
So what I was trying to say is, apart from the four, that is hepatitis B, syphilis,
okay,
blood grouping,
yes,
and then sickling status, we need to also know the status of the man in terms of the fertility.
Okay.
You know, they should try also to let us do this semen analysis.
Okay.
With the women, they should also test for their fertility state.
Okay.
It is good so that, and this exam should, they should encourage the people to have this examination done earlier, so that if there are conditions that they need to treat, they will even have it treated before they get into marriage.
Oh, okay. Okay. So we want to know the implications if you don't do this other test that you are talking about. What are the problems if they get married?
Okay. Thanks for the question.
Okay.
Taking it one by one.
Okay.
When you pick the blood group, for instance,
okay,
it's necessary we know our blood group before marriage, because the woman might have been to a particular blood group.
Okay.
And the man too will be into a particular blood group, but they might not meet. Why am I saying this? A woman can be, let's say, AB positive.
Okay.
And the man can be whatever group negative.
Okay.
Here's the case that when there is a pregnancy, it's the woman that is carrying the baby.
All right.
And the probability for the child to pick either the man's group or the woman's group is not known. It is done at random.
Randomly.
The child can pick the father's group, and take what we call the resource factor, the negative or positive that you see there. We call it resource factor.
Okay.
So you can be resource factor D positive, or resource factor D negative.
Okay.
So if the mother who is carrying the baby is as I said, AB positive, and the man is, let's say, O negative,
Negative.
and the baby happened to pick the father's O
Okay.
and pick the mother's resource factor D positive. Along the line, something might happen and there will be a mixture of blood. That is the mixture of the baby's blood and the mother.
Okay.
When that happens, the baby immune system will recognize the pregnancy. No, the mother immune system will recognize the pregnancy as a foreign object
Oh.
and it will fight it and kill it.
Wow.
When it happens like that, the system will develop antibody against pregnancy. Whatever pregnancy that you have, it can't survive. You can have a series of pregnancies by its own standard. That
So
is the more reason why when you want to marry, they want to know your status and know that of the woman's status and see they are compatible before they get into marriage.
so some of the miscarriages that we are having,
Are coming from that
blood
end.
group. Wow. Wow. Okay.
When we take the sickling, for
Okay.
instance, as we know, or for the listeners to know,
Okay.
sickle cell disease is a group of inherited blood disorders.
Okay.
To be precise, a defective hemoglobin cell on the red blood cell.
Okay.
We have types of it. We have the normally is the S. We have hemoglobin S, hemoglobin C, hemoglobin A. The defective ones are the C and the S.
Okay.
Let's say I'm a man. I want to go into
Okay.
marriage,
Okay.
and I'm having a blood group AS.
AS.
And the woman I'm going to get married to is having AS.
AS.
I have a defective trait.
Okay.
The woman too has a defective trait on it. The probability that we give birth to sickle cell is very high
It's very high. Okay.
because we both have defective hemoglobin to be SS.
Okay.
When you do the crossing, you have AA2.
Okay.
That is when you try to pair the AS. AA means a normal person. You can have AS2 and then SS will appear in one. When you do a cross matching, you have AA2, you have AS2,
Okay.
and then you have SS1.
Okay.
But then as to whether you will give birth to AA, AS, or SS, it's not known.
Okay.
It happens at random.
Okay.
It may happen that all your child that you give birth may have the SS.
Wow.
And as the S is a defective gene, it has a health implication, a lot of health implications. The sickle cell is a disease that affects the red blood cells.
Okay.
You know, when you are sickle cell anemia, your red blood cell doesn't have the normal biconcave shape that we know, but it rather has a sickle shape.
Okay.
When that happens, as they move through the blood vessels, they get stuck and prevent the blood from flowing to other parts of the body.
Oh, okay.
And you know, the hemoglobin or the blood is going alongside with oxygen that supplies the body part. So if blood supply to a particular part of the body is limited, the cells try to die and it causes damage to the organ.
Wow.
Some can become blind as a result of that. Because there are blood vessels connected to the eye that need blood. So if sickle cell gets stuck in there and blood supply to the eye is limited, you may lose your eyes as a result of the sickle cell anemia. There are other things.
Okay.
You can even get a stroke out of it.
Wow.
Because there is blood constantly flowing into our brains and then coming, goes and come. If the cells get stuck in there, it will prevent blood from getting into the other part of the brain cells, and it can cause stroke.
Wow. Then it's very important to check our sickle cell, because if what he's saying is true, we not getting ready and getting everything tested, it can lead to blindness, which means the child that will be giving birth will go blind and the child will suffer. Okay, the other ones.
Yeah. And then we have talked of blood group, we have talked of the sickle cell.
Yes.
Let me say a little bit about the sickle cell before we move to the other ones.
Okay.
You know, those with the sickle cell defective cells, they have a constant shortage of blood. And
Okay.
the body moves or is able to function well as a result of the bladder flowing through our nerves or our veins.
Okay.
So if your blood cells keep on dying, just like we know how car uses fuel to run,
Mm,
and the car is getting shortage of fuel, you know what happens? The
yes.
engine stops.
Okay.
Yeah, so it's a health implication that needs medical attention.
Attention.
That's the more reason why that we need to know our
Sick.
status before we get into marriage. We talk of sickle cell and then blood group, and then we also have the hepatitis B.
Okay. Let's talk about that one.
Hepatitis B, fine, it's good to know, but it can be managed. Compared to the sickle cell anemia and the blood group,
Those
that
cannot
one,
be
when you
managed.
get into marriage, the implication is very
Very
high.
high. Okay.
But the hepatitis B, if the other partner has it
Mm,
and you don't have it and you get married, you can get it through sex, through body contact
oh, okay.
and other stuff. But when you get it later, it can be managed.
Okay.
But it still needs to be known so that
Before.
if the other partner doesn't have it and the other has it, you that does not have it, do not have it, can go for a vaccine.
Okay.
There's a vaccination that you can have that
Oh,
can prevent you from having it.
so that vaccine, at what age can we take it?
Vaccine can be taken at birth.
Okay.
Some pregnant women have it.
Okay.
When they discover that they have it during their antenatal care, the doctors monitor it. Once the baby is put to birth, there's a specific even injection that they give to the baby so that the baby will not get it. Because it can be transferred into the baby through what?
Then,
Delivery,
okay.
you know. Yeah. So with the hepatitis B, if you know your status and your partner also know his status, one has it. The one that does not have it can quickly go for a vaccine. So
Okay.
vaccine has no age.
Age
You can have the vaccine
at
at
any
any
age.
age.
Oh, okay.
Yeah. Now talking of syphilis,
Syphilis.
sometimes they request for what we call VDRL. That's Venereal Disease and Research Laboratory. That's the
Okay.
name.
Okay.
Syphilis also is very necessary. Syphilis has been one of the main reasons why most of the women or the men are infertile
Wow.
now. Yeah, it's a bacterial infection caused by what we call treponema bacteria, the name of the bacteria that causes syphilis. When you have it, it can affect your sight going forward.
Okay.
It can even affect your brain cells.
Wow.
It can cause what we call meningitis, that
Wow.
is inflammatory of the brain cover.
Okay.
When you have the syphilis and you left untreated, it can lead to what we call PID in women, pelvic inflammatory disease.
Diseases. Okay.
It can also cause tube blockage. Most of the ladies, young ladies, have gotten married now and they are not able to give birth as a result of infection that they had it and they did not know and they did not treat. Some
Wow.
tubes are blocked that they are finding it difficult to conceive.
So what are the effects or signs when someone gets syphilis? What signs does it show that the person will identify that this is syphilis?
Okay, so we will talk about the infection in general.
Okay.
Fine. The hepatitis B is also caused by caused by a germ, but not a bacteria.
Germ.
It's
Okay.
caused by a type of germ called virus,
Virus. Okay.
specifically hepatitis B virus. That's
Okay.
the name that causes it. With the syphilis, some of the signs that you know that you have it. You can be urinating frequently. You can have rashes around your genitals.
Okay.
Being a male
Oh,
or a female, you can have a painful sex in terms of the woman. When they are having sex,
They'll
it's
feel
very
much
painful.
pain.
You can see a discharge,
Okay.
a vagina
Discharge.
discharge or penile
Which
discharge.
color? White or?
Sometimes it could be whitish, it could be yellowish.
Okay.
Yeah. Now, back to we have talked of
Hello guys, so this the
sickle
first
cell,
part
we
of
talk
the
of
health
blood group,
implications
we
needed
talk
to
of
be known before
hepatitis
marriage.
B and
So our next video is the second part. Please touch the subscribe button and watch more videos. Thank you.